Well, good afternoon, everybody. How's everybody today? I'm the last session on, so it must be very important. So please pay a lot of attention. So lovely seeing some beautiful, welcoming faces here today as I arrived. I'm looking forward to catching up with you. Those that I've met before, thank you so much. And those that I have yet to meet, thank you very much indeed. Okay, so today I'm going to do a short presentation on how to recognize the different skin types, and more importantly, how you need to know what your skin type is and to take care of it. So let's have a look. Let's start. Right. Ahead you have a cross-section of the skin. Now, the important thing about the skin is that there are three important layers of the skin that you need to be aware of. But more importantly, you need to know about the dermis, which is the middle portion of the skin. If you look at this cross-section of the skin, you will see a top layer called the epidermis, which is characterized by the yellow spongy layer on the top. The next layer down is actually the dermis, which is known as the true skin, and the layer beneath it is known as the hypodermis, which is the layer that provides us with insulation and protection of the vital organs that we have in our body. The important thing is that we need to take care of the true skin, which is actually in the dermis. Aging begins there. So, in order to have a great youthful looking skin, we need to nourish the skin with active ingredients that will help prevent aging and other such environmental factors that we're confronted with. So let's have a look then and recognize some of the various skin types and skin conditions. There are a lot of myths and misconceptions in today's society about exactly what is a skin type and what is a skin condition. So hopefully in my small presentation today, you will learn a little bit about the skin. And please feel free to actually come and see me at any time during the course of the next couple of days, and I shall, talk to you about it a little bit more privately. So what is a skin type? A skin type is something that you're born with. So it's actually a genetic predisposition to an inherent characteristic of a skin. There are essentially only three skin types: alipidic, which means devoid of fats; oily skin, which has an overabundance of oils in the skin; and sensitive skin. What is a skin condition? A skin condition is an acquired manifestation, and it is influenced by the environment. The environment meaning the climatic changes that we are exposed to, hot and cold temperatures, incorrect use of cosmetic products on our skin, stress issues, lifestyle, alcohol, smoking, medication, a whole host of other influences can lead to various skin conditions. So bear in mind that there are only three skin types, but a multitude of skin conditions. So when you're going in for a treatment, say in a salon, be aware of how your skin is analyzed and understand the meaning of a skin type and skin condition. So what exactly is normal skin? People talk about skin being normal. Realistically, it's very rare. You don't find normal skin. Normal skin is actually found in children up to the age of about 12, 13, when they reach puberty. When you look at a normal skin, it looks velvet in its touch. The skin is very firm. Its skin looks very hydrated, free of blemishes, and the texture of the skin is not only firm, but the color looks as though the skin is even throughout. And by that, have a look at these pictures that I've actually got here, one slide I have on normal skin, and that is what you're looking at. So once you reach the age of puberty, normalcy does not reside on our skins anymore. Okay, another myth, combination skin. You know, folks, it really doesn't exist. Combination skin was created by manufacturers to sell a cream to you so that the skin could be addressed because of its various characteristics. It is scientifically incorrect to say that I have a combination skin. What you need to do, what your therapist needs to do, is to identify those areas on the skin that are oily and those areas on the skin that are dry. So, we need to then treat the skin according to its requirements. I have here a slide showing a combination type of skin, and if you have a look, you can see the areas that are oily are normally in the T-zone, and areas that are dry are around the periphery of our face, around the sides. I wrote a book on skin analysis and skin evaluation because in my travels in Australia and indeed throughout the world, I noticed that people were not analyzing the skin correctly, and therefore were using products that were not suitable for their particular skin type and or skin condition. So my skin analysis now is part of a training manual that is used in Australia and in some overseas countries to scientifically and correctly analyze the skin. The things I look for are the texture on the skin, the secretion of oils from the skin. We're looking at hydration, which is the levels of water in the tissues. Looking at pigmentation, and most of us, unfortunately, are afflicted in some way with pigmentation problems because of the climatic influences such as exposure to the sun. I look at elasticity in the skin because the loss of collagen and elastin in the skin provides or gives us an appearance of fine lines, wrinkles, deep dehydration lines on our skin. I look at things such as circulation. We look at broken capillaries on our skin. You know, the spider veins that you see on your face. I look at complexion, whether it's ruddy, that means do you have a reddish looking face? Is it bilious? Are you sickly looking? I look at sensitivity, and sensitivity is either you're born, which is part of your skin type, or are you sensitive to environmental factors? And I look at other things on your skin as well, such as scars, superfluous hair, and things like that. So here's a number of little slides showing what a few skin types and skin conditions look like. The first is aging dehydrated skin. If you look closely here, you can see the lady there on the left-hand side of the picture of the two ladies. Fine lines and wrinkles along her eye area, crow's feet, on her forehead. The vertical lines, they're known as corrugator supercilii lines. Most of us tend to have that if we're frowning, expression lines, and of course other lines and wrinkles on the face. The next one is the sun-damaged skin. This is your pigmented skin, age spots on the skin, number of different causes, so we need to look at how to protect aged skin. And here we have someone who smokes a lot, and you can see the fine lines, wrinkles all around the mouth area, and you can see redness, broken capillaries on her cheeks as well. And many of you who attended my presentation in the youth launch throughout Australasia, New Zealand, and Singapore might remember that I said that whenever you smoke a cigarette, one cigarette depletes 25 milligrams of collagen. And it takes a lot to actually build that 25 milligrams of collagen back into your skin, so why would you? Okay, so now let's have a quick look at the different skin types. The first one I said was alipoid. Alipoid means devoid of fats. And alipoid skin is characterized by very fine, almost transparent skin. It has broken capillaries because the skin is very fragile. It may have some dry, flaky patches on the skin. There may be other premature lines and wrinkles. The skin may be sensitive, and the pore size, which is scientifically referred to it as ostia, and again, those of you who have actually attended my previous presentation will know that I talk about FO, and it doesn't mean I'm swearing at you, it means follicular orifice. Okay, some of the causes of alipoid skin are obviously internal factors, which are your nervous and endocrine glands, leading to poor hormonal balance that leads to poor sebaceous gland activity, and this leads to dehydration. External factors are your harsh atmospheric conditions, poor diet, diets that lack fats and oils, and by that I mean good fats and oils, diet lacking in water because the skin is not hydrated, topically using incorrect products on your skin, medication, alcohol, smoking, and insufficient protection from the environment, such as not using sunblock when you're out in the sun or wearing hats and clothing that prevent sun damage. Okay, how does the youth cream support the alipoid skin? There are a number of active ingredients in the youth cream that actually assists in the alipoid skin, so why would you not use it? Aloe vera is one of the main ingredients in the youth cream, and it has an active ingredient called aloin. It has a number of vitamins, such as vitamins A, which is anti-aging, vitamin B, which is a vitamin responsible for healthy hair, skin, and nails, vitamin C, which is an antioxidant, choline and folic acid, which are important in the formation of collagen in your skin. Youth cream contains a number of oils. One of the important ones in there is sunflower seed oil. It has beta-carotene, which is your vitamin A, and it's responsible for increasing cell mitosis and cell proliferation, which is anti-aging. It also boosts your collagen and elastin production in the cell. And here we have a repeat of what I've just said previously, so let's move on to the next one. Okay, alipoid skin and home care advice. What you need to do when you have this type of skin. Always use the sunblock when you get out into the environment to protect against sun damage. Use the youth cream as a hydrating moisturizer, and avoid substances that are diuretics like lots of coffee. And unfortunately, I'm one of the biggest sinners around because I do love my coffee. Avoid drugs, excessive alcohol, cigarettes. Avoid fat-free diet. That means have the good fats, such as those found in salmon, mackerel, avocado. These are great fats. Avoid extremes in temperature in the environment. Drink plenty of water and take your recommended dosages of A, B complex, C, E, and zinc, as well as your essential fatty acids such as omega-3 and omega-6. Okay, here we have a slide showing an oily skin. As you can see, this lady's face is fairly shiny. This is only an over-secretion of oil without the production of a lot of blemishes that are usually seen on an oily skin. So oily skin characteristics, these are some of the characteristics that you need to look for if you have an oily skin. Your skin may be thick and coarse. Large FOs, which is your ostia, skin may be rough to touch. You may have comedones, which are your blackheads, whiteheads, pustules, papules. Asphyxiated skin means you can feel the lumps and bumps under the skin. and your skin may look hepatic, which is sickly looking. Causes of oily skin. You have internally maybe an endocrine malfunction, creating an excess of androgens, a sluggish lymphatic system. Lymphatic system is responsible for the removal of wastes out of the body, and acidosis, which is the buildup of uric and lactic acid in the body, as well as having incorrect diet, which may lead to very poor oily skin. External causes are usually topical applications of harsh products onto the skin, medication, and of course, atmospheric conditions. How does the youth cream affect oily skin? How does it support it? Well, again, it contains aloe vera. Aloe vera also has the ability to behave like a humectant. And a humectant is a substance that has the ability to draw and absorb water to itself, very much like the collagen and the elastin, which is actually found in the dermis, or the true skin known as the corium. The youth cream has grapeseed oil. Grapeseed oil in the cream behaves like an astringent, and that is, it tightens the FOs by contracting the tissues together. It also behaves as an antioxidant by neutralizing the free radicals and reducing the appearance of fine lines and wrinkles. Home care advice is to cleanse the skin with gentle cream-based cleanser that doesn't contain any irritants. The important thing with the oily skin is that you need to exfoliate, and you need to encourage exfoliation by using things such as alpha hydroxy acids and beta hydroxy acids. Alphas clean on the surface of the skin, whereas the betas actually enter the follicular orus and clean the FOs from inside out. And that is very important. The youth cream is fabulous in the sense that it behaves like an antioxidant. So it removes harmful radicals away from the skin. Not only is it an astringent, but it also contains a host of vitamins that are responsible for assisting in preventing pigmentation. For an oily skin, you need to have a proper diet. So you need to avoid foods that are rich in saturated fatty acids, such as lots of oily foods, I suppose. Be careful when you go to Indian restaurants, where the curries are steeped in oil. I love spicy food, and I especially love licking the spicy oils that come in the curries. However, and I'm one of those you'll probably see in the restaurant dipping my finger in and then licking them, we need to avoid that. So if you have an oily skin, don't. Enjoy lots of fresh fruit and veggies, whole grains and seeds in your diet. The last skin type is sensitive skin type, and here you have a picture of a lady showing redness all along her cheek area. There's some broken capillaries, and the skin's looking asphyxiated because if you touch that skin, you may feel a few lumps and bumps. The problem with the sensitive skin is that the local temperature on the skin is usually raised, and sensitive skin does not like a lot of treatments being done on it. So you have to be very, very careful as to how you can treat sensitive skin. Okay, some of the characteristics of a sensitive skin are very thin texture. The FOs are very, very small. The skin appears blotchy in its appearance. It's warm to touch because the local temperature is raised. And sensitive skin is prone to allergies. So again, you need to be very careful when you're visiting a salon, and ask them first what type of treatments will they be performing on your skin after they've done a thorough skin analysis. Some of the causes of sensitive skin is an impaired acid mantle that causes capillary damage, skin lacks natural oils, so it appears to be fragile, and the skin is sensitive due to allergic reactions. Some of the actives in the youth cream, how do they work? The youth cream is great for all the different skin types that I've just spoken about, because regular use of the youth cream will protect against environmental aging. It also protects against sun damage. It protects against water loss. It behaves as an astringent. It helps to reduce the inflammatory condition that may compromise the lipid barrier. It enhances skin luminosity, cleanses the FOs and refines them, and it helps to boost the collagen and elastin production in the skin. Okay, treatment objectives for any skin type, whether it's alipoid, oily, or sensitive skin. You need to cleanse according to your skin type. Use a toner to refine the FOs in your skin, and you need to moisturize using the appropriate moisturizers, such as those that have active ingredients found in the youth cream. Remember, for any skin type, you need to protect against sun damage, and you need to maintain a healthy diet according to your body metabolism and your skin conditions and skin types. And that actually, ladies and gentlemen, is my very short presentation on skin types and skin conditions. Now, this afternoon, there's going to be a lucky draw for some associates in this room, and I'm more than delighted to conduct free skin analysis for you over the next couple of days. So if you are the lucky recipient of a free skin analysis with myself, please bring with you your makeup, so that if you wish to wear makeup after the analysis, you may do so, or you may leave your skin free after the analysis. So thank you so much.